Good evening, everyone. Thank you so much for joining UK Doc's first mini conference on flexible working as a healthcare professional in partnership with Flexa Careers and Locum's Nest. My name is Rahul. I'm a YOD ambassador and I'll be your host tonight, as well as talking alongside Dr. Lydia Edwards later on this evening. Before I introduce our first two guests, on behalf of UK Doc, I would like to say a big thank you to our sponsors, Draeger UK and the British Association of Critical Care Nursing. Before I introduce our first two guests, just a couple of house rules. Please, if you can all have your webcams turned on and your microphones muted. You can also use the chat function to ask questions to our panelists during the discussion if you so wish, and there'll be a 30-minute Q&A at the end of this evening. So without further ado, I'm delighted to introduce our first two guests, Dr. Ahmed Shahrabani and Miss Molly Johnson-Jones. Ahmed graduated from the University of Sheffield in 2014 and went on to start his first medical post at St Helier Hospital in London. In 2016, he co-founded the award-winning Locum's Nest, connecting thousands of healthcare professionals to temporary work in hundreds of hospitals and GP practices across the UK. In 2021, the Financial Times identified Locum's Nest as one of the FT 1000 Europe's fastest growing companies, and Ahmed himself was recognized by Forbes for his role at Locum's Nest as one of the 30 under 30 healthcare and science leaders destined to shape their field in the next 50 years. Since March 2019, Ahmed has also been a fellow at the NHS Innovation Accelerator. And our second guest for this evening is Molly. Molly is the CEO and co-founder of Flexa, an innovative platform that verifies a company's flexible working policies before allowing them to showcase their roles on the platform, and thereby giving their end users complete transparency. From the age of 18, Molly has lived with an autoimmune condition, which made traveling into the office very difficult. Whilst working in an investment banking role, she asked the company that she was working for to work from home for 1 day a week. And 10 days later, she was asked to leave. But soon after, Flexa was born. She has since closed 2 rounds of funding with Flexa and regularly speaks on gender inequality in the startup world and the perils of raising money. She has a first-class degree from Oxford, is a trained chef, and loves spending time with her dog, Gruff. Let me now pass the mic over to Ahmed, who will talk about his experiences.
Yeah, thank you very much, and hi, good evening, everyone. Thanks for joining us. It's quite late on a weekday evening. Molly, we'll get straight into it. So, I mean, I'm sure we'll talk about ourselves in great detail, but a lot of the work we do is with the NHS, and I'm sure I'll eventually blabber on as to what Locum's Nest is. But one thing that has been a real shift in all of our worlds is moving towards flexible working and less than full-time working and all sorts there. Have you, with your work at Flexa, experienced any other very, very large companies, acknowledging the NHS as the 5th largest employer in the world? Doesn't need to be that scale, but large companies who weren't previously flexible that have made the transition to flexible working, and any lessons learned, so to speak, because we all love lessons learned in the NHS on how they got there.
I think it's a really good question and a good point, that large companies are very, very different to small, nimble startups. Locum's Nest yourself was our most flexible company of the year, but it is easier for a smaller company to be flexible, particularly if it's all traditionally office-based work. Whereas obviously in the NHS, you have to have people that are sitting in hospitals, in doctor surgeries, in sort of admin roles, and actually being present. And what we've seen is that since the pandemic, there has been more of an awareness of embracing flexibility in different ways. So not just in terms of location. And what we've seen those trends sort of emerge as has been definitely more flexibility in hours, in terms of there might be people that, and I'm not necessarily speaking about the NHS here, because sadly we haven't been able to look into their flexible working and flexify them. I wish we could. In terms of maybe shift work, having more choice and control over those shift hours, making sure that there are caps on certain hours that are done. Also looking at flexibility in terms of more paid holiday, more paid sick leave, looking at career breaks, sabbaticals, like the ability to kind of move around and flexibility in those different respects, I think has definitely garnered more attention recently. And it's a way that large companies are embracing flexibility when they might not necessarily be able to do working from home.
No, fair. And is there usually a trigger that you found for large companies to kind of turn on this switch, or is it just being around others doing the right thing? We all acknowledge it is the right thing, but I'm guessing sometimes it's a not so good trigger that leads to it.
People leaving is often one of the biggest triggers. I always say that there is a growing brain drain away from less flexible companies towards more flexible companies. I think definitely there is an element of osmosis in the sense that companies will see what their competitors are doing and want to emulate that. But ultimately, the way that companies are kind of being forced to embrace flexibility is because people are leaving.
Yeah, there's plenty of that with colleagues, us included, you know, moving away from full-time jobs in the NHS and going for a more flexible role within UK healthcare, mostly being the NHS, given how large it is.
Yeah, exactly.
Cool.
Awesome. I think I'll switch over and start asking you some questions. Otherwise, you're going to be listening to me the whole time, which like isn't particularly interesting. So obviously I mentioned there about sort of career breaks or moving. You mentioned about moving out of the NHS. How easy would you kind of say that it is to come back into practice after you've taken time off from clinical medicine? Like, what did you actually have to do?
Yeah, no, so that there's no playbook here, nothing, which is really sad actually. So for everyone that I don't know on this call, which is probably 98% of the people here, one familiar name which I'll pick up afterwards from the guest list. But yeah, so my story is very straightforward. I graduated from Sheffield in 2014, worked in South London for a couple of years as a junior doctor, then did the odd kind of pseudo trainee, but not quite a training program in ENT in Guildford. But then when Locum's Nest kind of sprouted as an idea, left full-time medicine and then went full-time Locum's Nest. So from 2016 until, well, a year and a half ago, I hadn't walked into a hospital wearing a doctor's hat. It was very much a Locum's Nest hat to see if we can get the app involved with the trust to help flexible work, which I'll talk about at length, I'm sure. But when the pandemic hit, of course, the GMC sent out emails to all doctors who had licenses frozen or had recently gone into retirement asking for help. I was one of them. I wanted to get back on the wards. It was something niggling away at me for a long time. And so I got my license reinstated at wave one of the pandemic, did a crash course in medicine. And it sounds ridiculous. You train for 5 to 6 years and then pandemic hits and you have 5 to 6 days to get back up to speed with the basics. And I was quite lucky because, as I said, there is no quick re-entry or quick defrosting of your medical knowledge to get your license back from being frozen. But I'd contacted loads of old colleagues on various respiratory firms that I used to work at and shadowed a team for a week, just always with somebody, of course, read the Oxford Handbook of Clinical Medicine as quickly as I could to see if what changed, if anything, and a lot had changed in the 4 years. I think it was like 2 editions later. Yeah, so I mean, because there's no guidance. So you decide to go back in and you're kind of just thrown in the deep end, which is quite dangerous. So I just took the incentive of reaching out to old colleagues who are now senior regs and some, very junior consultants, shadowed them for a week, and then it's just picking up bank shifts. So there's no other way of doing it flexibly in the NHS. I've contacted Health Education England. I've contacted various other large governing bodies about, I've got a full-time job or a semi-full-time job. It's very much a full-time job at Locum's Nest, and I want to pick up the odd shift here and there. I'm happy to commit, X number of days a month. And the response I got was, well, sorry, unless you're committing, at least 3 days a week, we don't classify that as enough to be less than full-time. I mean, in my head, Christ, 4 days a week is full-time. So the gap from 3 to 4 days a week going from less than full-time to full-time is quite narrow. So yeah, to summarize, I guess it was a bit of an odd time with the pandemic, and of course the NHS was desperate. They still are desperate for doctors, nurses, and all other workers. It's still a crisis. But I, at a personal experience, just took the initiative of quick 1-week course of shadowing, quick revision, getting back to hospitals that I'd worked at in the past. So at least you knew where the cupboards were that had blood vials and where you'd go to book a CT scan and, you know, all of that stuff. Because otherwise it's really tricky. And I'm sure a lot of people on this call resonate with that, you know, you are more comfortable as a doctor working somewhere you've worked in the past. It's a shame that nothing more formal exists centrally for people to get back into practice, because it is a big wall that you have to leap over, and you don't know how far down you're going to land on the other side, because things change. You know, hospitals implement electronic health records now, and they seem to forget that less than full-time staff exist, and they train all their full-time employees, and then you as a part-time employee go into the hospital, and when you're used to going through, you know, paper-based medical records and folders, and, you know, spending half your day putting papers back into binders, you now go into a computer where it says, computer says, no, you haven't done your training. And you're like, well, nobody invited me for my training. So you kind of get left behind on that front. But, you know, something centrally has to change soon for this. I mean, people like us at Locum's Nest, we try and do what we can to cater for people who want to pick up the odd shift here and there, and the team are amazing, and they'll guide you as to, okay, this hospital or this trust is really helpful if you're into cardiology, or this hospital is really helpful if you're into anesthetics or whatever. And you know, it's good, it's really helpful, but it's not the same as having a much more formal route of getting into things and being supported and getting trained. Because people like me, you work full-time Monday through Friday. On the weekends in hospital, you operate what is called skeleton rotas, right? So you tend to just do your thing, be safe, leave, and you don't really get much training. So there's a big delta in what should happen and what currently does happen, and hopefully there'll be a stimulating conversation with the others on this call, because a lot to talk about.
You said there that kind of doing the shifts, or like on Locum's Nest, and actually coming in sporadically is the only way to sort of access flexibility. Why do you think that is? Like, what do you think is stopping the NHS from being able to have people that are part-time or coming in, you know, for a few different shifts every week or every month?
Yeah, there's so much here. I mean, flexible working is a new concept for the public sector, I'd say. You know, we can define what new means between us, but it is new. And, you know, with the NHS, grassroots innovations tend to do best because they're adopted by fellow clinicians or, you know, colleagues within the NHS. Top-down mandates tend to face stiff resistance because a lot of things have failed in the past, and rightly so. That you should question top-down mandates if you don't agree with them in principle, if you think they go against, you know, patient care or how colleagues and fellow staff members are looked at and looked after. The thing with the NHS, and I've heard the saying so many times, is there are more pilots in the NHS than there are in the RAF and British Airways combined. And what that means is that if something is working at one NHS hospital, its neighboring hospital, which, you know, could be connected by a bridge, which is true by the two trusts in the country, where two separate trusts, they've got a like an air bridge connecting them, but they don't talk. And, you know, that's why there is no top level mandate, because so far there are, you know, hospitals working in silos, and that's why you need people like us. And we're not the only people out there doing this. So I'm going to say we're the best. Of course I am. That's my job, and I firmly believe it. But our job is to go in trust by trust and say, you've got to empower your doctors. You've got to enable flexible working. The world is changing. Patient demands are changing as well. It's not just the workers. The patients coming in much more informed than they were 10, 15, 20 years ago with resources available to them. And you have to adapt. So that's why you get private, you know, it's a private company, it's taboo, but really it's not. We're from within the system, coming in and saying, okay, this is what we believe will change. You empower your workers, you empower your trust, and ultimately you improve patient care. And yeah, it's long-winded, it's a hard slog, but it needs to happen until the guys up top realize that the world is changing.
Yeah, no, I completely agree with that. It genuinely is very interesting that there's obviously such an underutilized workforce of people who are perfectly qualified to do the role and to work within the public health sector, but they're not unable to because they can't commit to it full time. Like, I find that incredible.
Yeah, I'm sure it's not the only, I mean, I'm sure you must have come across other sectors in the UK, public or private or a hybrid, where, you know, there is a big drive for flexibility, but the challenge is reaching that senior manager or senior leader to get to them. I mean, if there are lots of people on this call, how would you, from experience in other fields, how would you recommend they approach that manager or that senior leader to try and enact change? Because sometimes the rules are hard written, and, you know, they're written in black and white from 80 years ago, and rules are rules, and now you kind of convert rules are rules to computer says no, which is even worse. But yeah, how do you make change happen?
It's really hard, and I think there's kind of 3 case studies of different scenarios. I think the first one is, like, if you are in a role that can be done flexibly and you're not being afforded flexibility, then leave, because the job market is so candidate driven at the moment that actually it's pretty easy to get another job. But I appreciate that not everybody is in that position where there's just another flexible role that, you know, you go on, hopefully Flexa, look for a job, you find it, you know, you'll get hired, great. But that's definitely not always the case. You might be in an industry that is still hard to get flexibility, but there's not so much of a reason for it not being possible. Like, it's not like you're literally working in a shop or a restaurant or a warehouse or in a hospital. And in those industries, I always say to people, if you're trying to change management and kind of senior leadership's mind, then the most compelling way to do that is with data and evidence of what a positive impact this will actually have. Or, on the other hand, you know, slightly threaten them with people will leave and you will lose people and there's going to be a mass exodus. But painting that picture in data is always incredibly useful. You know, the number of people that are willing to leave their jobs for more flexibility is currently at 71%, which is one of the highest that it's ever been, where people are like, actually want to leave. And, you know, I'm sure everybody's read about the Great Resignation. That was in the US, and resignations, I think, in November and December of last year peaked at an all-time high, and sackings were at an all-time low. And we've just started to see that same evidence in Europe, where resignations are at an all-time high and sackings are at all-time low. So if there's ever a time to go in with a business case for flexibility, it's now, because senior leadership are feeling quite precarious, I think, in their positions of being able to retain staff. And if you can provide a potential solution to that, I'd be very surprised if they weren't willing to listen.
Yeah, no, I completely get it. What you've just articulated sounds a lot like a lot of our various meetings with, you know, medical directors, clinical directors at NHS Trust that we're trying to get in and not convince, but work with them to say, you know, we all know this is the right thing to do. How do we make it happen? And that backing data is surprisingly helpful, you know, despite it being a no-brainer to everybody, that this is the right thing. Another thing I did want to ask is, all jobs are stressful to some degree. Healthcare jobs are particularly stressful for lots of reasons. Yeah. You know, from experience, it's a different kind of stress. So, you know, as a doctor, you go in, you see a patient, it's incredibly stressful at times for lots of reasons, be it acute, chronic, or whatever. You go home, you know, you do start to think about, oh, should I have done this? Or, oh, did I do that? And then it kind of lingers with you. And you end up calling the hospital or the ward at 2 a.m. in the morning and asking how patient so-and-so is doing. And you do that because you care. But with other jobs, like in the city or, you know, in health tech, it's a different kind of stress where your bloody phone is always going. People are emailing 24/7. Sometimes people are complaining. Sometimes people are just genuinely interested. Different kind of stress. How do you switch off when you leave work, or how do you recommend people switch off? Because I'm sure this is something that comes up a lot.
Comes up a lot, yeah, especially in a world where we're so super connected, and it's obviously very hard to switch off notifications, let alone switch your brain off. I think that it depends on the kind of person that you are, and understanding that first and foremost is quite important. Like, I personally, if I muted my Slack notifications, oh, there we go, my Slack just went off. If I muted my Slack notifications and emails and I didn't look at anything, I would be really anxious waking up the next morning. That's just me. I wouldn't enjoy that. I probably would wake up in the middle of the night worried what I'd miss. So for me, switching off is about finding a way, like knowing what I can do to switch my brain off, which might be, you know, normally it's doing exercise or going for a walk, or on a Thursday or Friday, going to the pub. But knowing exactly what does enable you to switch your brain off. But if you are the kind of person that needs boundaries, then I really can't recommend like leaving your phone outside of your bedroom, turning your notifications off and creating those boundaries artificially if you can't be trusted to do that yourself. But it really depends on whether that's going to add more stress to you, if you're the kind of person like I am. But the world, you know, very often tells you, oh, keep your phone outside, turn your notifications off, you can just switch your brain off and eventually, you know, meditate or do some yoga and it'll all get better. But like that's ultimately quite a big lie for a lot of people. And so it's finding out what works for you. And that could be having a bath and a glass of wine. It could be turning your notifications off, but not being ashamed to do that either, and being comfortable telling people when boundaries are set, and how you want to work as well. Obviously, I understand that's harder in hospitals, or if you're in like emergency surgery or something, there's limited boundaries that you can set, but when you have that downtime, making sure that it's protected.
And so I know I'm kind of barraging you with questions, but the one that directly follows on from that comes to me is, well, if it was kind of regimental Monday to Friday, 9 till 5, you can almost create that routine of, okay, I'm going to get up at 7 or whatever, get ready at 8, get to work for 8:30. You're almost kind of warming up your engine or your brain, and then you can cool it down after you get back from home, and you know you got a routine, and then that routine you can almost help you switch off. But with flexible working, part of flexible working is having irregular or self-chosen, you know, timetables of when you go to work. Some could be evening shifts, some could be mornings, some could be nights, some could be weekends.
Yeah.
Does that almost muddy the water a bit to make it even more difficult to switch off at home, or have you found other things that contradict that argument?
I think for a lot of people, it definitely can do. And I think it really, again, it depends on the sort of person you are. If you're someone who needs that routine and needs those boundaries, then even when working flexibly, it's really important to set them anyway. But there are some people who thrive with a lack of routine and disorganization, and that is me. So I quite like, if I'm tired, I'll wake up later or go to bed later if I've got lots on, and I can flex that around my schedule. But it's not abnormal to want to say, no, I will work 9 till 6. And we see loads of people working at really flexible companies with like no core hours at all, but they're like, no, I still work 9 till 6. Like that's still what I want to do. And they still take an hour for lunch at the same time every day, and that's in their calendar. It's very much like, I think flexibility has been touted in the media as like this lack of boundaries and total freedom. Whereas actually flexibility, I think, is about choice, and it's about choosing whether you want a regimented structure. It's about choosing whether you want a total lack of structure. It's about having the freedom and the autonomy and trust to choose that, and not being told that the in-office 9 till 6 every day is the right way, being empowered to make your own decisions. So I think we're eventually, hopefully, the rhetoric and the discourse around it is going to shift back to the idea of choice, rather than saying the most flexible companies are the ones where you can travel every day, go to a different city every weekend and still be working. That's an extreme of flexibility. And that's why we measure it at Flexa as well, so that people can know what is going to be on offer at a company, whether it is that total freedom or whether it is a slightly more freedom within a framework, for lack of a better phrase.
No, that makes sense. Total sense.
Yeah, exactly. I was going to come back to Locum's Nest, and I'll give you a chance to sell yourself here with my question. I was going to say, like, what are the pros and cons of working via locums agencies such as Locum's Nest versus NHS, going via NHS banks, for example?
Yeah, so now I'm sure there's a couple of Locum Nest people on the school. They'll hate me saying this, but I hate trying to sell things, especially out of hours. But no, so really, I mean, one very clear distinction is we created. Ooh. Sorry there. Hi, Symbol. Sorry. No, so I thought it was a question. No, so we being at Nick, who's the other co-founder, we worked together, both doctors in South London. We created it to basically the problem we're trying to solve was, I'm sure a lot of people kind of have experienced this, is gaps in NHS rotas lead to people coming down and asking if you can pick up extra shifts. Failing that, it's a barrage of phone calls, emails, texts, bleeps, senior doctors coming down and twisting your arms politely to ask you to pick up the odd shift here and there. Failing that, the hospital would go out to a bunch of locum agencies to try and find a doctor. And again, that would create lots of phone calls, emails, texts. And we just thought, you know, it was at the time where Uber was up and coming, and excuse the blunt analogy, but Tinder was up and coming, gaining traction in kind of the mid 2010s. We thought, you know, doctors are highly regulated. We value autonomy. Why can't we be in charge of, you know, finding extra work when we want, rather than being bombarded with this kind of scatter fire communication that is, it's just the world's biggest fishing net, trying to, the world's most blunt instrument, trying to find a doctor for a shift with no precision, doesn't take into account the seniority of the doctor, the specialty of the doctor, whatever. And the NHS was spending 4 billion quid on locum agencies. So we thought we can definitely cut out the middleman. And yeah, so we created Locum's Nest back then to save the NHS billions of quid on agency fees. So we're not an agency. Our slogan for the first 4 or 5 years was forget agencies. And what all the app does in its simplest form, it does a hell of a lot more than this, but if you're a doctor with a GMC number, you can download the app, have a play, it's completely free, and you can put in your specialty, your grade, various other things that are super helpful for your appraisal and revalidation. And it'll show you literally every single trust in the country that we're working with, all of the shifts via bank at the trust rates that you can pick up, and you can apply for those shifts, join a staff bank at a trust. And the idea is that if you join one staff bank and that trust is part of a collaborative or a group of trusts working together, you don't have to do your folder of HR checks over and over again to work at multiple trusts. And that's ultimately the benefit of a locum agency. Is you join one locum agency, you have access to multiple trusts. You join one bank at a trust, you have access to only that bank in the old way of doing things. We're in the middle here. So we're saying, download the app, join Locum's Nest, join a bank within a collaborative, and all of a sudden you'll have access to 10, 12, 15 trusts worth of shifts. And you can just literally see the shift on the app, click to apply, be approved, get paid, and you get paid every penny. We don't take a cut out of a doctor's pay like agencies do. So it's having that visibility of shifts, and that's why we're probably eating chunks out of the locum agency market. My only fact of the day I hope I give is we've helped the NHS save 0.8 billion quid so far in agency costs, which is cool. It's probably the most successful thing I've done in my life so far, or the proudest thing I've done. But yeah, on the way to save 1 billion quid. But it's for the doctor, ultimately, it's that giving the doctor back control and not asking you to do the same thing 100 times to reach the same goal, which could be done once, if that makes sense. I know it's very, very niche, very specific way of describing things.
Yeah, that saving is genuinely amazing though, 7.8 billion. And I guess part of that is that also giving people access to being able to do this alongside a normal career, like you have. I say normal career, another career, just like you have. Like, do you see many people signing up where that is the case?
Yeah, no, that's fair. So most doctors on the app, and there are about 50-ish thousand doctors using Locum's Nest now, which is roughly 1 in 2. I could stand extremely corrected here if everyone on this call says, oh, what's Locum's Nest? And then my sample size is extremely flawed. Yeah, most doctors using Locum's Nest have a substantive post, a full-time post within the NHS, and they use it to pick up shifts at their own trust or a neighbouring trust or another trust that they've worked at in the past. But we're seeing that change. So when we first launched, it was almost 90% to 10%. So 90% full-time doctors who picked up extra shifts, 10% were the flexible workers who either had other careers or only worked flexibly as locums or via the bank. That's now changing, so it's almost 75-25, which still the vast majority is that, but actually, we've got a factor of 5 increase in number of doctors who are doing other things as well as their full-time posts. So times are changing for sure. We're seeing a lot of things changing within the NHS with the whole concept of collaborative banks, i.e. trusts working together. It's leading to changes with doctors' appraisals or revalidations, et cetera, et cetera. So fully expect something from the centre to come out soon to basically give formal advice on what to do if you're not a full-time doctor, because there is an unbelievably low amount of guidance on this if you can't commit to that 3 days a week minimum. It's like 3 days a week minimum or you're on your own, which is really harsh.
Yeah. What do you think is driving that sort of 5x increase in people that do something else alongside wanting to do that? Like,
it's multifactorial for sure. And I'm sure a lot of reasons kind of are echoed in other industries, the UK and beyond. I mean, so when we founded Locum's Nest, it was the year when Jeremy Hunt was in power. It was the junior doctor strikes, and within my cohort of FY 1s or 2s at the time, I can't even remember, 55% of us left full-time training, mostly to go to Australasia or to go somewhere else or to go into consulting or whatever. Some of us came back, some of us didn't immediately. And I initially thought that number was a one-off. It was like this just sporadic, Hunt and Power, junior doctor strikes, like times are really bad, but it's going to go back to normal. Not normal, but it's going to get better with more people staying. But actually it's gone the opposite. So I don't know what the exact figure is for last year, but I believe it's somewhere between 60 and 65% of trainees left their post to do something else, be it, locum for a year, go into another profession, but basically not continue full-time training. So that is definitely fueling the trend we're seeing at Locum's Nest, where a lot more doctors don't have full-time posts, but are using the app to work flexibly, to maintain their license to practice, because there's no other way. I mean, I've one fun story of a really interesting guy that I met and interviewed about a year ago. I think it's on our website somewhere, but a really interesting guy, a chap called Dr. Gilbert Greenall. Fascinating. He's lived an amazing life. He traveled the world with the UN as a kind of a military doctor. He helped form Kurdistan as a region. He's gone all over in the Far East to help set up humanitarian camps and provided care, seen everything, seen all sorts of stuff, and is still a medical SHO, senior house officer. So it's an old term, but I guess if there are 5 grades of seniority, 5 being the most senior and 1 being the most junior, Molly, it's probably grade 2, like fairly junior. That's where I am currently. And he is extremely happy staying there. This gentleman, incredible guy, is probably in his early 60s, late 50s, and is happy practicing as an SHO, because you still get that patient interaction, which a lot of us on this call probably really like, and it's the reason why we do this. He has the other job with the UN and whatever, where you deal with numbers and data and stats and figures and whatever, but you have that more of kind of a public health, large patient population impact, but you miss that one-to-one. And a lot of doctors, that's what they miss. It's what I missed. And that's why kind of dipping your toes in as a SHO and working flexibly as an SHO is actually really rewarding. And it is completely okay to still be an SHO well into the future. And you don't have to go up that consultant ladder, which was ingrained in a lot of us as med students. So I mean, that's Locum's Nest. We've seen a gradual transition to employers accommodating flexible work, and we've seen that with improved training and whatever. But what kind of challenges have you experienced, encountered, advised on when you've seen or helped employers transition from a more rigid working structure to more flexible working structure? And if there are any challenges, have you got any kind of cool tactics or recommendations to tackle them?
I think probably the biggest challenge that companies and organizations have is very easily solved, but they don't tend to actually do it. So I think one of the biggest problems is that coming out of the pandemic, they implemented policies and ways of working that without actually asking any employees what they wanted. So they kind of, senior management decided that like that was what it was going to be. And it sounds like the NHS could also learn from this too and actually listen to what people want. But we saw companies come to us like, oh, we've just implemented hybrid working, and no one's coming back to the office apart from when we do team days or when we've got kind of like strategy meetings. I would say, well, did you ask people when they wanted to come to the office? Like, there are two different types of work now that exist, and one is work that you do when you're in the office, which is collaborative, like you're not sitting there on emails all day and you're not on Zoom calls all day. When you're at home, that's when you should be doing your emails, doing maybe your focused like work that needs to be done on your own, and doing Zoom calls. And companies very much didn't listen to their employees about the kind of work they wanted to do in two places. So they really struggled to get people back in the office. Then they were like, okay, well, maybe we'll go fully remote. And then they didn't have that, what I call like the complementary effect between remote and in-person work that happens, where people build relationships, you have a company culture, people feel more comfortable interacting online once they've met in person as well. So they definitely kind of had those sort of pitfalls. And another one that definitely started to emerge, and I think hopefully a lot of those companies have rescinded this, but they said that they will implement a flexible policy, but it has to be requested. And so people would have to put in that formal request process, jump through 5 or 6 hoops, justify the need for flexible working. And very often people would leave before they even bothered to go through that request process, because it's effectively signaling that that is not the normal way of working, and companies don't really want that culturally. And what we see is that one of the most important determinants of success in flexible working is senior leadership role modeling it too. And that is the case across all industries, across all types of company. It doesn't matter what the type of flexibility is. It could be working from home, flexible hours, taking holiday, working different shifts. Senior leadership need to be leading by example. Otherwise, people feel very uncomfortable availing of it too. And we saw companies come to us and say, like, in theory, we're really flexible, but people aren't really working flexibly. It's like, well, are your senior leadership working flexibly, or are they standing by the lift saying good morning to anybody that arrives past 9:30? Like, you hear horror stories of it, and they do genuinely happen. The one story that I heard was somebody working at one of the big four, shan't name which one. Their partner that looked after their department would stand by the lift at 5 o'clock, and if anybody left between 5 and 5:30, he'd ask them if they had a half day. Which is ridiculous, but it's those kind of passive aggressive gestures from senior leadership that can really, really ruin flexibility, and I think that's very commonly overlooked.
No, fair. I mean, this question might be quite off-piste, but we're working with roughly 50 odd trusts in the country. If we were to say, Molly, we're really keen to really work on this one trust, we're quite innovative, great leadership, want to do something differently. Who would you want to be in that first meeting if you were to join us? Who would you want to be on the first meeting? And I guess, what are the first steps to make change happen? I know it's maybe not an easy one to answer and may not be as simple as that, but really keen to understand the type of people you'd want to speak to.
You need to speak to the ultimate decision maker in that. So whoever is in charge of setting those policies, often like a chief people officer or head of HR or somebody you definitely need to speak to. But also you need to speak to the person that is ultimately in charge of that trust or organization or company, like the CEO or managing director. Because without the buy-in from both of those people, there's absolutely no chance that company will become flexible. And you also need the buy-in of those people to be able to disseminate a survey, to be able to ask what people actually want, and to be able to start benchmarking where that organization can actually get to. Because without that information, you've got no hope of actually being able to make it genuinely flexible. So often they would be pretty much the only two people that would be absolutely key to making sure that they were bought in for that change.
Yeah, no, fair. I tend to agree. And I think one thing that you've mentioned a couple of times now is getting feedback and acting on it. And it's really sad, actually. At the moment, the NHS has this thing called the staff survey, which, if people on this call have substantive posts, I'm sure they would have been exposed to and would have had a kind of shoved down their throat multiple times. You know, we want your feedback, we want your feedback. And you get different departments saying, oh, medicine has got an 80% response rate, where surgery's only got 60. You know, why aren't the surgeons filling it? But the sad thing about this is it is only for substantive workers. So if you are a less than full-time worker or a flexible worker, you're not invited to give your feedback. It is second-tier feedback. And we're getting whispers that this is going to change in the future. We're running our own things on Locum's Nest to gain this feedback from tens of thousands of doctors and get their voice heard. But, you know, I think that just speaks volumes as to what the status quo is at the moment. And
to get any useful back, it has to be a representative sample of the people that actually work there.
Yeah, and you know, now it's not. It's arguably 3/4 of the workforce. You're missing a whole quarter. But yeah, so I'm conscious it's 8:50. You know, I'm getting kind of the evil eyes or thumbs up going. Coming up, guys. So we'll.
Yeah, really sorry about that. I'm sure we can be talking about that all night. But thank you both. Thank you, Ahmed. Thank you, Molly. And a big thank you to Locum's Nest and Flexa Careers for their input in supporting and creating this event and their ongoing partnerships. You know, both of your stories are really insightful, and it's really refreshing to hear somebody else's story on how they saw an opportunity, broke convention, and carved out their own path because of personal, you know, difficulties experienced. So thank you both. Thanks both very much. If you wish to find out more about Flexa Careers or Locum's Nest, please check them out at www.flexa.careers and https://locumsnest.co.uk. I'll be putting all these details in the chat window at the end of the conference this evening. So on to our next two speakers for this evening, one being myself and the second being Dr. Lydia Edwards. Lydia is a junior doctor and is currently a clinical teaching fellow at the Hull York Medical School, having completed a foundation training in August 2021. Next year, she will be progressing to a senior clinical teaching fellow role before embarking onto specialty training, specialty yet to be decided. She studied medicine at the University of Leeds, where she also undertook an intercalated degree in medical education. She is a YOD community lead and is also a qualified fitness and LEMIL instructor with a passion for both the physical and the mental benefits of exercise. Lydia will be talking about her reasons for wanting to take time out of training relating to mental health, career development, and not having yet chosen a specialty. And on to myself. I'll be talking this evening about my journey after medical school, some difficult periods following my foundation years, and how I'm working now in Formula One motorsport, as well as A&D, and how flexible working has allowed me to achieve this. So it's just starting with myself. I graduated from King's College London in 2013 and also undertook an intercalated BSc in management at Imperial College London, and I'm now working towards a master's in sports and exercise medicine. I currently work in Formula One, where I'm the team doctor for Aston Martin. This is a role I've been doing for the last 3 seasons. And when I'm not at the track, I also work as a registrar in A&D at the Queen Elizabeth Hospital in Birmingham. And one of my passions is also music. And when I am able to, I sing for the City of Birmingham Symphony Chorus. So my story is a bit of a varied one. After completing my F1 and F2 year, I wasn't entirely sure what I wanted to do. All of my colleagues at the time were either dead certain on pursuing a specialty, and those that weren't sure were of the mindset that, you know, I think I'll apply for GP training because it's a safe option, and after 3 years I can subspecialize and do this, that, or the other. So I at the time, there were very few of us who were taking an F3 year, and this was back in 2015, where it was just a comical way of saying that you're just taking a year out. You know, nowadays an F3 is an accepted year, and more junior doctors are taking one. And personally, I'm a massive advocate of this and strongly encourage all foundation year doctors to do this. Why? You know, most of us, after completing our F1 and F2, have been on the medicine conveyor belt from school to uni to foundation training, and becoming a doctor is no small undertaking. And we're making decisions at the age of 17, which determines what we will be doing for the rest of our working lives. the only real decision that we do get a chance to make is what specialty that you choose. So I think, taking some time away from rotas, from nights, from weekends really helps you gain some mental clarity and helps you figure out what's really important to you and what's really important for you in your life. So for my F3 year, what did I decide to do? I became a trust grade in A&D, where I would still be working nights and weekends and would still be on a rota where I would have little flexibility in my life. And what else? I applied to GP training, managing to get a post in London to start the year after. After a few months of being on the rota, and a lot of you must know that, yeah, it's not nice. So I quickly defaulted into zombie mode. I was working for the sake of working. I was going into work, dreading it. The moment I stepped into the department, I was counting down the hours and minutes of when I'll be finishing the shift. This wasn't every day. Obviously, I was still very junior in my career as a doctor, and the learning curve is massive. But after a while, those days of dread became more and more frequent. And I began talking to other doctors, many of whom were locums, and became quite envious of the lifestyles that they were leading. So I called it a day with the trust grade post and decided to join some locum agencies and started working all over the Midlands, not only in A&D, but my interests were also orthopedics at the time, and also did some work in acute med. With the locum life, I loved the flexibility that came with it, and it was just nice to take a step away from doing CBDs, mini kexes, and reflections, and I felt really liberated. Obviously, the downside of this is the lack of career progression if it is something you want to do long term, and also for job security, which is what a lot of my colleagues advise, that this lifestyle that you lead is unsustainable, which is fair enough. But at the time, I just needed to take some time out and just do me. And it was during my F3 year as well where I started solo traveling. This wasn't prompted by being a locum as such, but with the flexible working life, I was able to get away for a fairly long period of time. During my F3 year, I was going through a really messy breakup, which had a negative impact on my mental health. And I did the very cliche thing of, let's go backpacking. And so I went online, bought a pair of hiking boots, backpack, and the Lonely Planet guide to Central America on a shoestring. I just booked a one-way ticket there. And it was during those few months that I really felt there was more to life than working endless hours in a hospital where, more often than not, you're overworked and you're underappreciated. I remember when I was away, I visited an orphanage in Guatemala, and the children literally had nothing. Even just spending a few hours with them, they seemed like they were the happiest people in the world. And all of a sudden, the problems that I had back at home became really small. These guys are a fraction of what we have, and we're spoiled, surrounded by all these gadgets, gizmos, technology, and paradoxically, we're kind of worse off for it. So after my trip, I got back to the UK, fully well thinking that I'd missed out on so much at home. First day back, it was as if nothing had changed. I'd gone through all of these life-changing travel experiences, but everyone was still doing their 9 to 5. Starting work on a Monday, looking forward to a Friday, weekend goes by, and then Monday again, and it's repeat. And then another thing dawned on me that, are we really living, or are we just trudging through life because this is what society is telling us to do? And I just decided that I'm going to do more of me and, what makes me be me. Working hours on end, it's easy to become embroiled in the rat race, and we just stopped living. And fundamentally, I didn't agree with the system, became fairly disillusioned and rejected my GP training offer, and just wanted to see where this locum gig took me, really. I found that I was able to dictate where and when I worked. I was able to start doing things which I never had time for. It was then when I auditioned for a choir and started singing again, was able to weight train a bit more consistently and just do things which I've always had an interest in, but wasn't able to do because of the rota. I just had a lot more control over my life, and I wasn't a slave to anyone anymore. which was so nice. And I think this is something that I would really urge those of you who are in a bit of a limbo right now to do, just to start reconnecting with yourself a little bit more, and to do what makes you happy. I know I spoke about lack of career progression with the locum life, but there are still ways that you can progress up the ladder if you chose to. I've completed all of my A&D middle grade exams, something which I did fairly casually over the past few years. And I know that if I wanted to, I can re-enter training through a CSER or a DREAM pathway. I haven't actually looked into any of these options now, but it's something that I know that should everything go belly up, I can always default to that. And then Formula One happened. How did I land that gig? So I ask myself this most days. I get asked about it a lot as well. It was the beginning of the pandemic. I was on another traveling stint in South America, hiking up a mountain in Argentina. And I just remember casually talking about this coronavirus thing with another doctor that I met from the States. Both of us were just fairly dismissive of it, just thinking, it's going to be another chicken flu or swine flu hysteria and it will die down. But a month later, the world was closed. So got back to the UK. Was still working in A&D and battling on the front line. And a former colleague of mine, Darren, who also worked in F1 at the time, was telling me that there was a recruitment drive for more doctors because pre-pandemic, there were 3 doctors looking after all teams in the paddock. And with the bubble system, they needed 1 doctor per team. So thought nothing of it. And he told me that the week after that he put my name forward, and okay, cool, fine. Well, thought nothing of it then, really. So then June came, received a phone call on a Friday afternoon from this Italian bloke whose company supplies all the doctors for Formula One, and asked me, so can you come to Austria in 3 days' time, in time for the season restart? And all of a sudden, it just all became very real. I got into this fanboy panic and just knee-jerkingly accepted the position, and the rest is history. So Darren at the time put forward 10 names or 8 to 10 names of those he thought that would be good for the role, but I was the only one available at the time, and to make the move to travel. And my situation was, I was a locum registrar. I had the experience sufficient to enter that stage, and being a locum, I was available at short notice, and none of the other guys were. So it was quite fortunate in that respect. And I had a good working relationship with my department at the time, so they were able to let me go without any issue. Yeah, it was right place at the right time. I count myself lucky every day. The opportunity presented itself, and I was ready. Had I still been in a trust grade role, this wouldn't have happened. Had I been in a training pathway, dropping out would have had some serious repercussions. And that's my story. Fortunately, things worked out favorably for me in some respects, and I wouldn't have been able to do what I am doing now had it not been for the flexible work that I've been doing for the past few years. Would I do this job my whole life? Probably not. It's not a job conducive with having a family, and that is something which I would like to have at some point in my life. So, I just think that there are more important things to life than money. More important than celebrity. And at the end of the day, you need to do what makes you happy and not what makes the system happy. Talking to my colleagues in the NHS, a lot of them are really feeling the burn at work, which I'm sure so many of you are right now, especially post-COVID. The demand is through the roof, and the enjoyment that my colleagues once showed on their faces has just vanished. And it's difficult to see because I work with some genuinely brilliant people. A lot have dropped out of training, and some have just left the profession altogether. And my take home for you guys would be that don't become a slave to work. Nobody on their deathbed wishes that they worked more. And unfortunately, being doctors, a lot of us are in that sunken cost fallacy mindset where you say to yourself, oh, I spent 6 years plus training to become a doctor. I've amassed tens of thousands of pounds in debt, so I must choose a specialty. I must become a consultant or a GP. And my question to you is, why must you do that? Easier said than done, but just try and get out of the mindset whereby you just do what makes you happy. Take up those interests, you do those activities which you had to give up because of your medical commitments. Play the piano, join the local rugby club, start traveling, read, expand your mind, just be your own individual and take ownership of your life and never let anyone tell you otherwise. And I know a lot of you have probably taken up training posts, but taking some time out for your own sanity, I think, takes precedence over anything else. And there are opportunities outside the NHS if you look hard enough, but looking is made difficult if you have constraints working all the time. So that's my story. I'll pass it on to Lydia. Hope she's managed to put her 2-year-old niece to bed by now. On to you.
Yeah, I'm very sad that I missed like the first part of the conference, so I'm gonna have to watch it on catch up. But she literally went asleep at 8:15. She should have been asleep at 7:30. So, but yeah, as soon as mum and dad are gone, it's different ball game, isn't it? So, but yeah, literally, I managed to get down here for the start of your talk, Rahul. I'm probably not going to offer anything quite as profound or interesting as being a F1 doctor. As you know, I couldn't do it because I wouldn't leave Toto Wolff alone to do my job. I just follow him around because I just enjoy his voice. So I would make a very good F1 doctor probably for that reason. But yeah, my job is perhaps not quite as interesting, but maybe a bit more attainable for more of us. But yeah, as Rahul kindly said at the start, I am a clinical teaching fellow for Hull York Medical School. So my reasons, obviously, as Rahul mentioned kindly when he was talking about me at the start, I'm in an F3 role at the moment as a clinical teaching fellow for Hull York Medical School. So I work for the medical school 4 days a week, and I do 1 clinical day. So at HIMSS, they encourage us to do 1 clinical day just so that we're doing some clinical practice. But it's a really flexible role, which I'll come to shortly. But in terms of why I'm doing it, my reasons are threefold, really. The main one is my mental health, and that's what led me to becoming a community lead for UK Doc. So when I was on my GP, I've always been somebody who has had anxiety. I've always been a very anxious person, but it's never got to the point that I felt like it really was hindering me. I have had online guided self-help in the past when I was a student, and put an awful lot of, I'm somebody who would revise until 11 o'clock at night because I would be so anxious about exams. So I've always been a very anxious person, and then had the normal nerves in F1, but again, I wouldn't say at a point that hindered my life outside of work, the normal F1 nerves. But then in my GP F2 placement, really took a mental health hit. So I found there was numerous factors that affected that, which I don't think it's appropriate for me to share on a webinar like this. But there were numerous factors that led to my anxiety taking the hit, and it basically led me to a point that I just couldn't cope with the uncertainty that GP was presenting, and that just kind of spiraled and spiraled and spiraled after about 2 months in GP. The problem with that is, although I knew I already wanted to do the clinical teaching fellow job, the other thing that presented was that I wanted to be a GP. And then I had this awful experience in F2 and was like, oh my God, I absolutely cannot be a GP. And basically didn't know what I was going to do with my life anymore. And honestly felt like I just wanted to run away from medicine altogether at that point. And decided to do the clinical teaching fellow job. Now, as I say, there was multiple reasons. I already knew I wanted to do the clinical teaching fellow job. I intercalated in medical education. I went to University of Leeds, and I intercalated there and did a intercalated BSc in applied health medical education, which I loved, and I think my backup career probably would have been being a teacher. So it's, you know, the educational world I really enjoy. So intercalated in med ed, and then I had planned on doing a clinical teaching fellow job. But then because of that, and because of the hit that my mental health took, and that my career aspirations being called into question so strongly, I'm doing that job for another year. In terms of the job, in terms of flexible working, it's a great job for flexible working. And as Rahul was saying about F3, obviously now so many of us do an F3, and it really has become, for me, particularly in doing jobs like this, it's as well as having time to just figure out what you want to do, it's great for career development. So for me, the clinical teaching fellow job is great for my career development, because I know that I want to go into medical education. And my reasons for that, as well as enjoying it, protecting my mental health, is also because of the flexibility that it will give me with my future career. And the teaching fellow job is great for getting some education experience on your CV at quite a junior grade that you wouldn't get the same extent just doing it ad hoc teaching. So like I say, I teach for 4 full days a week. I work for the medical school. I only do 1 clinical day. And that's very flexible at the Hull York Medical School. So there are some of the teaching fellows who don't have clinical days, and they just locum on their days that they don't work for the medical school. We have time in our contract for admin, for research, for studying. So I'm studying for a PG cert as well. And you know, there's time for all that stuff that you've usually got to fight for and do in your own time during foundation training. Doing this job, there's time for all of that in my career plan. In my job plan. So for example, today I was doing lesson planning and I was studying for my PG cert. So it's a great job for taking time out of training. There's about 10 of us at the minute, and at least two are actually registrars. So although the job is targeted at F3 level, I think for numerous reasons, one person has done it because they've got a newborn, they had a newborn and they wanted to take some time out of training. So you can take time out of training to do it. And actually some people have done that and taken time out and then have gone back into training less than full time and still work for the medical school, just like 1 day a week. And that's, you know, part of their career now. So for me, it was my mental health. It was a career decision, but it's a career decision because as well as being something I enjoy, it's for me something that I want to be part of my long-term career. And obviously, as I said at the start, that's kind of what brought me to UK Doc. And I think I realised last year, I thought if I do this full time for the rest of my life, I can do it. I just won't be happy. And something that I didn't realise was important was the flexibility over my career. And it kind of dawned on me like 6 months ago reading something. I was like, do I want my annual leave and my life dictated to me by the NHS for the rest of my life? We had a consultant who took a day of annual leave to do something work related because he knew he wouldn't get the time off work to do it if he didn't take annual leave. That is just so absurd that that's the industry that we're in, that we have to use our annual leave to do professional activities because that's the only way to get the time off. That's just mad. And I don't think I'd realised until about 6 months ago, when my anxiety and things had started to improve, that having that autonomy and flexibility of my career is something that I hadn't realised was so important to me until now. And when I speak to other people now, they're like, well done for realising that at F3 level and not in another 20 years time, and making the decisions now that are going to give you a good life and a good work-life balance in 10, 20, 30 years time, and give me longevity in a career that I really enjoy and looks after my mental health and well-being. So that's kind of me, a bit about my job. And I'm not sure if I've got anything else to add at that point. But yeah, if anyone has any questions kind of about obviously we'll be coming to a Q&A later, but I'm happy to obviously answer any questions anybody has specifically about the teaching fellow job, and what that kind of entails. But I would definitely advocate it to other people, even if medical education isn't necessarily your ultimate goal. It's a great and a very flexible year out of training, which is great for your CV and gives you a lot of opportunity to do those other things. And actually, by taking the time out, having therapy, having medication, and having time to reflect on the experience that I had and understand how I got to that place that I got to, I do now plan to do GP training. But it's taken me, academic med ed GP training, but it's taken me, nearly now knocking on for 2/3 of the year out of training to get to the point where I go, actually, I do still want to do it, and to be able to look back and say it wasn't the career, it was just lots of situational factors that kind of got me to that place. And then, as a side note, great, the flexibility that my teaching fellow job gives me. I qualified as a group fitness instructor, which is something that I love. I liked how you pronounce Les Mills, Rahul, Les Mills. I was like,
it was French.
in my Hull accent, I just go Les Mills. So yeah, I am from Hull. That's why I moved back, because my partner's in Hull. So yeah, it's like Les Mills in a Hull accent. Although sometimes it just come out as Les Mis. But anyway, but yeah, I qualified as a level 2 group fitness instructor last year. And it's a hobby, but it does top up my salary. So for example, I very rarely do locums, because through the fitness instructing, I do make enough extra money just to top my salary back up, because obviously doing the CTF job, it's all 9 to 5. So my salary has gone down a bit compared to last year. But obviously, as Rahul said, it's as long as you're happy, the money doesn't matter. So for me, I do it as a hobby and a passion, and something that's great for my mental health. And I love being able to share that with other people. At 6:45 this morning, I was in a room of like 20 people just having a great time doing body attack. And then my day has been improved since, because it's so great to connect with people doing that. And I think when I was younger, I was like, if I didn't do what would I do? And when I speak to when I'm teaching and I say to them, I try to encourage my students to set themselves good boundaries for not revising like I did until ridiculous times, because my 2 pennies worth would be, if I didn't pass my exams and I wasn't a doctor, it wouldn't have been the end of the world. And when I was a student, to me, it felt like, if I don't pass these exams and I'm not a doctor, then what was all that hard work for? I would have felt like my life would have been over. And although now it is part of my identity, it wouldn't be the end of the world if something happened and I couldn't go on to carry on doing it. But I think that doing this job and being able to explore other opportunities has really kind of been great for me and inspired me to, like you were saying about doing sports and exercise medicine. So lifestyle medicine, sports and exercise medicine is kind of where I see my future going now. And as you kind of mentioned about subspecialising as a GP, that's the avenue I see myself going down. But if I hadn't have taken a year out of training, I would have never have come to that conclusion. So yeah, as you said, Rahul, I'm a big advocate for stepping off the hamster wheel and just taking time to step back and think, actually, what do I want? And thinking, actually, it's not the end of the world. And that's kind of what I advocate to the students and the more junior doctors that I work with at the minute. But yeah, also I love Yod for challenging the stereotype that we can be doctors and have mental health problems. And I think that the message that they share about having anxiety and being a doctor is so powerful. So I'm here as hopefully a representation of that our anxiety doesn't have to stop us. We just have to find a way of making life work for us. If I went back to being a barmaid, I'd still have anxiety. But yeah, and also it was a really boring job. It wasn't for me, but yeah.
Thank you, Lydia. That was really lovely to hear. Thanks for sharing your story. You know, a really great and personal insight into your life and your work life. And I'm sure your story resonates with so many people in our profession. So hats off to you for being so open about it. There'll now be a 5-minute break. Afterwards, we're going to have our 30-minute Q&A session. So synchronized watches, we'll be back at 2050. See you guys in a few. Hi, everyone. We are back. Seem to have lost Molly somewhere, but it's all good. We're going to be starting our Q&A session now. So if anyone has any questions, please use your raise your hand function, and I will open up the floor to you.
I'm just going to make a quick comment, Rahul, because I've had a direct message. I won't name the person because it's not appropriate, but obviously. I can... Let me just double check if there's still someone here. Yes, hopefully they can hear me talking. I'm not blagging my Instagram because I'm rubbish at using it. But I have an Instagram which is at Live Well with Lydia. So I'm tagged in the posts on UK.doc. You might be able to find me through there. If you want to message me privately, just to have a chat about anything, I'm happy to kind of connect with you out of here and have a chat. Okay, so hopefully the person who's messaged me, you can hear me. Or if there's anybody else who doesn't kind of want to reach out now, but just wants to chat and informally about kind of my experience and where I've got now, this message I've got's kind of like, yeah, I feel you. So feel free to reach out to me on Instagram or and you can find me through UK.doc and we can chat. Okay.
Lovely. Yeah, and just moving on from that, Lydia, so just a second to that, I'm going to be putting details for the four of us on the chat page. So if anyone wants to message us directly, they can do, if they don't want to be asking any questions out loud over here. So, yep, any hands for any of us? Yep, we have. Calvert Malkin. How you doing, mate?
Hi, guys. Can you hear me?
Hi, yes. How you doing?
Hi. First of all, thank you both for sharing your stories. They're both something I very much resonate with. So just to give you some background, I'm an F2. I'm on ICU and I'm planning to take an F3, and quite similar to Lydia, I have been thinking, I've applied for some teaching fellow jobs, and I see medical education as something that I'd quite like to do. And I just had a question saying, when you said you wanted to be a GP and go into sort of academic medical education, what exactly does that entail? Do you mean being a gypsy with a special interest in medical education, or is there another route? Or
So what I'm referring to there is that I have to admit, I've not looked, because I actually ran away from wanting to do GP training. I kind of stopped looking into everything. And I'm going to be really honest, right? Okay, I ran away so much from medicine during my F2 year that when people talk about what exams you need to do to get into different specialty training, I'm like, what? Like I literally don't even know what exams you need to do for all the training programs, because I had zero interest. And I just didn't want to do it. And when people talk about all the different training programs and how you can get onto them, I honestly have no idea, because I didn't want to do them. So I didn't even find out about them. So I have to admit that my knowledge, there might even be someone on here that can give you more information, but what I've recently come across and was mentioned to me by somebody else is that you can do a 4-year GP training program rather than 3, and you do it, and it's the academic training program, and you can then, one of the options on the academic element is to do medical education. So you apply for GP training and then you apply for the academic fellowship training program. And my understanding is, I might be wrong, don't take this as gospel. My understanding is you might get a GP training offer, but then not get the academic training offer. So you do 2 applications. but yeah, so you can make your GP training 4 years rather than 3, and an option for the academic element is medical education, and then throughout the training there's a year of academic and med ed stuff. So for me, I know that I want medical education to be part of my to be part of my future career. But yeah, my clinical teach, it's honestly amazing. It's I absolutely love it. I love the teaching. I'm doing research. I'm doing a PG cert. I teach 4 Les Mills classes minimum a week. I don't work any bank holidays. I don't work any nights. I don't work any weekends. When I needed to go to therapy, just booked it because I had the time. I didn't have to fight for time off. So it's an awesome job. And you know, people will have different reasons for wanting to do things like that. But yeah, it's a really nice job, and it's great. It's literally a CV dream. The opportunities that you can have time to pursue. But yeah, hopefully that helps somewhat to answer.
No, that did. Thank you very much. And just another question. I know obviously it seems very personal to you, so please share as much as you like, but what was it about GP training when you did it as an F2? Because I haven't had that experience. That sort of, was there something stand out that repelled you, or was it just the job?
Yeah, I'm an open book from a personal perspective. For professional reasons, there's things that I kind of obviously won't go into, but there was situational factors related to the actual placement.
Okay.
There were I had personal life stresses that kind of, I hate the word resilience, but my tolerance, you know, my threshold to have that kind of huge peak of anxiety was lower, because there was personal circumstances that was kind of draining a lot of my resilience at that point. So yeah, so my kind of tolerance of it was, I was already less. But then yeah, there was factors related to the actual placement. It was yeah, there was lots of challenging, and those factors made it very difficult for me to tolerate the uncertainty that GP presented. So that's one of the biggest things. I've had coaching. I don't know if you're aware, but as NHS, you can get free coaching for like career advice. So as well as having actual proper therapy, having CBT, I got a coach some people say to pick coaches that don't have similar careers for you, just to get kind of a wider perspective. But I picked a coach specifically who was a GP and did medical education, because I kind of wanted some insight from that.
Mm-hmm.
And I had career coaching, and I found that was really useful from that perspective. So maybe think about taking up that the career coaching. You get a profile for all of the coaches that are available, and you can pick somebody. And I found the careers coaching really helpful. And now I've totally forgot. This is what I do. I waffle and then I forget what the question even was. But yeah, there was multiple factors, but the ultimate point was that I really struggled to tolerate the uncertainty in GP. Okay. And that's something I know I'm gonna have to work on, and that's not going to go away. But I also went to the huddle a couple of weeks ago and had a chat with a great GP about uncertainty, and my coach talked to me about that as well.
Great. No, thank you very much. It's very helpful.
Thank you, Kaval. We have 2 questions for Ahmed. First question, how did you and when did you transfer from medicine to Locum's Nest?
Yeah, no, of course. So the idea came about at the tail end of my F1 year, so 2014-15, finished foundation training, as that was the advice we were given by a lot of peers that we had spoken to. May have been misguided or misplaced, but I'm grateful I did finish my foundation training. But Nick and I, who are both FY2s, we just finished our foundation training, both decided not to go into further training at the time. So that was August 2016. I picked up the odd bank shift here and there at the trust I just finished my F2 at, but it was a very, very abrupt stop So whilst we thought starting a health tech company could have been a kind of hybrid type role where you could have continued doing bank shifts and kind of continue working as a doctor, it very, very quickly became a hard realization that you've got to dedicate everything to starting a company. And we both went full-time locum's nest for the next 4 or 5 years, still are full-time, so to speak. That was the step. There was no playbook at all. It was just you learn as you go on with the whole fundraising and growing the team and hiring and creating the foundation of something that you want to grow and learning very, very primitive tech, etc. Learning on the job, but there weren't enough hours in the day to maintain clinical practice at the very early days.
Did you find it difficult, Ahmed, to transition from being a doctor to going into tech?
I personally think it helps massively if the tech you go into is within healthcare. From first-hand experience, I'm sure almost everyone on this call that works on the wards, we deal with shit tech. Like, I'm sorry to use the S word, but we do. Most technology in the NHS is atrocious. And it's sterile, it's horrible, it's laggy, it's built by people who have no idea what happens day to day, and is usually adapted from some, Windows XP software from the finance industry, adapted to healthcare and hoping it works. But having one foot through the door and picking up the odd shift, it's not many. I probably do 1 to 5 shifts a month. You understand the people who you're offering the tech to. You understand how the world is changing, and being an FY2 in 2016 is unbelievably different to being an FY2 in 2022 now. The people they speak to, it's different skill sets, different responsibilities, different shift patterns. Gone are the days of 24-hour on calls where you're on site, but there are different pressures now that we have to adapt to. And if you can get the tech to cater for that, it shows you're not from 10 years ago just forcing something down somebody's throat without knowing what they actually want. So yeah, very helpful.
And another question for you, Ahmed. Do you miss medicine, and how did you find leaving your clinical role into your current role? I
did miss medicine a lot from 2016 till 2020, 2021. I really hoped I could have kept practicing because it's what I wanted to be growing up. I really loved the job, so to speak, and it was tough to say, actually, we've got locums nest, we've got this company that's gaining traction, we've got a team now, we've got people's salaries we're paying for, and but you realize that the impact you're making is huge. We spoke about the financial savings, but actually, I had colleagues come to me and say, Ahmed, this has actually made my life a lot easier. I don't feel harassed all the time. I don't feel forced to do stuff I don't want to do. I actually feel empowered to do this. So that's what keeps you going, is actually realizing you're making an impact at a high level. But deep down inside, I did miss that kind of one-to-one patient-doctor interaction, the joking around, the helping out, the understanding who they are, getting to know people. But you try and keep that in your day-to-day life of working as a health tech founder or working within a health tech company. I'm now fortunate enough to be able to pick up the odd shift over the weekend at a number of hospitals that we work with as a doctor. Yeah, I'm only an SHO. I'll put only in quotations because I don't see it as a negative. But yeah, so now I get the best of both worlds, which is very lucky, actually. Although I'm just having to do my revalidation now, which is, it's bringing back lots of bad memories of why did I, what bits of this did I hate? And it's so stupid. I only work on COVID respiratory wards. Most patients are on, CPAP or whatever other type of ventilation they're on, and you have to get 20 patients to review you as a doctor. I think there is nothing more inappropriate than me going into a non-invasive ventilation ward and saying, here, review me as a doctor because I've got to do this. But anyway, I'm sure we could talk about this. Yeah, no,
I think it's still really good that you're still keeping in touch with the medical profession, because obviously, as you said, it's allowing you to change your. I guess you must be able to change your business model to cater for the differing needs that the NHS requires. So that's really great. So one from me to you, actually. So were there any points during your initial startup years where you were thinking like, damn, like, you know, made the wrong decision, massive gamble, I've left training. And did you have any of these thoughts at any times where times were difficult?
Yeah, and the short answer is no. Never regretted it. Never thought, oh, what if? Because I don't think there's a point of doing that. You know, that there's always this whole grass is greener on the other side mentality out there, and it's not really. The grass is as green as you make it, and the people around you make it. You know, with startups, much like a lot of jobs, you get either really, really bad days or really, really good days. There's never an average day. So, you know, you ride the peaks and troughs, and you know that something new is going to happen the next day if it was a bad day, and it could be a really good one the next day. So, no, I think we've been very lucky that the team around us are phenomenal. They work their shoes off, and all are on the same goal. And, you know, if you need a shoulder to lean on, people prop you up, and it goes both ways. I haven't thankfully thought, oh, I regret this, because I never have. And it's very lucky. But you know, you get dealt the hand you get dealt, and you play the cards you get, right? And
yeah, no, absolutely. I think if you're going to embark on something completely different to medicine, well, not completely different, then you need to go in, you know, 100%. And you should never have, I guess you should never have that mindset of that, you know what, if it goes completely horribly wrong, then I can always go back to being a doctor, because I guess you're not going to be putting in as much effort maybe because of that. But yeah, no, that's really great. Really, really great. Any other questions for us from anyone? Any hands? Any hands? I don't think so. Any private messages? None so far. Okay, guys. Well, thank you very much. I'm just going to be putting everyone's details who has spoken tonight. I've just added them to the chat group. Feel free to contact any of us, and we'll be happy to answer any questions that you may have, which you haven't had the chance to, or might think that you might want to ask after we're done. So on behalf of UK Doc, thank you all so much for attending tonight. Thank you for your time. And hopefully we'll be seeing you and speaking to you in the near future. Cheers.